My name is Erica Franco, and this is my presentation on vocal cord dysfunction. First off, I wanted to go over just the vocal cords and kind of the basics of them. What are vocal cords? The vocal folds, more commonly known as vocal cords or voice reeds, are composed of twin folds of mucous membrane stretched horizontally from the back to front across the larynx. So as we can see in the image down below, image A shows the vocal cords in the closed position, and then on image B, this shows the vocal cords in the open position. So where are the vocal cords located? The vocal cords are located within the larynx at the top of the trachea. They are attached posterior to the arytenoid cartilages and anteriorly to the thyroid cartilage. They are part of the glottis, which includes the rima glottidis. Their outer edges are attached to muscle in the larynx, while their inner edges, or margins, are free, forming the opening called the rima glottidis. So as you can see, here's the larynx right here, and this is the vocal cords inside. So what do? Your vocal cords are two flexible bands of muscle tissue that sit at the entrance to the windpipe, also known as the trachea. When you speak, the bands come together and vibrate to make sound. The rest of the time, the vocal cords are relaxed in an open position so you can breathe and allows air in and out. So again, as you can see, these are the vocal cords open when you are allowing air in, and these are the vocal cords closed when you are speaking. Vocal cord dysfunction. What is vocal cord dysfunction? It is a syndrome in which inappropriate vocal cord motion produces partial airway obstruction, leading to subjective respiratory distress. Common signs and symptoms of vocal cord dysfunction are shortness of breath or difficulty getting air into or out of your lungs, tightness in the throat or chest, most often the throat, frequent cough or throat clearing, a feeling of choking or suffocation, noisy breathing such as stridor, gasping, raspy sounds, or even sometimes wheezing, and a hoarse voice. Vocal cord dysfunction can come on suddenly and may be mild or sometimes severe. Without treatment, a severe attack may require emergency room treatment. Even if an attack is severe, the oxygen level in your blood is usually normal. Vocal cord dysfunction symptoms do not usually occur during sleep. So as far as triggers for vocal cord dysfunction, some of the main things are exercise, psychological conditions such as post-traumatic stress disorder, anxiety, depression, or panic attacks, upper respiratory infections like common cold, irritants such as ammonia, dust, smoke, fumes, or cleaning chemicals, post-nasal drip, or acid reflux, also known as GERD. Vocal cord dysfunction versus asthma is something that I wanted to cover because a lot of the time they're misdiagnosed. So the primary diagnosis to consider when most patients have respiratory distress or present with wheezing is asthma. Vocal cord dysfunction is often misdiagnosed as asthma. A careful patient history may help to differentiate between the two conditions. And unlike asthma, vocal cord dysfunction causes more difficulty with inspiration rather than expiration, and is commonly associated with a sensation of throat tightness or choking, versus with asthma, it's commonly associated with sensation of the tightness in the chest. Further testing like pulmonary function testing and laryngoscopy are usually needed to make the diagnosis between one another. So how do you know if you have vocal cord dysfunction? Vocal cord dysfunction can be very hard to detect. Your healthcare provider can find out if you have vocal cord dysfunction by testing your breathing with spirometry. This must include a flow volume loop. The test shows how well air moves in and out of your lungs. If vocal cord symptoms are present, the test will usually show a blockage mainly of the air flowing into the lungs. The best way, though, to tell if you have vocal cord dysfunction is for a health provider to look at your vocal cords when you are having difficulty breathing via a laryngoscope. As you can see in the image down below, it's a small, flexible fiber optics tube that is passed through your nose to the back of your throat where the vocal cords can be seen. Patients are awake during the test and may often be asked to speak during the exam to see if vocal cords work normally and if they're in the normal position. Another thing that some people may do is ask a patient to perform some kind of a high intensity exercise, and then they may perform the exam to see what the vocal cords are looking like as well. Differential diagnosis. Sometimes it's often anaphylaxis, angioedema, asthma, epiglottitis, hypoparathyroidism, laryngomalacia in adults, croup, presence of foreign body, tracheal stenosis, vocal cord paralysis, or vocal cord tumors or polyps are often things that are diagnosed when suspecting this. Risk factors for vocal cord dysfunction are recent upper airway inflammation, GERD, post-traumatic event that involved breathing, such as suffocation or near drowning event, severe emotional trauma or distress, female gender. There's an increased risk for younger females, and it's typically seen more in the female population versus the male population. Playing a wind instrument can also be a risk factor, and also playing competitive or elite sports. Diagnostic approaches. Pulmonary function testing with flow volume loop is the most commonly used diagnostic test to confirm the vocal cord dysfunction, as well as the laryngoscope. As far as how to treat vocal cord dysfunction. As far as treating vocal cord dysfunction, there are short-term treatments and there are long-term treatments. As far as short-term treatments in which patients are experiencing acute exacerbations, you can start by reassuring the patient, instructing the patient to in specific breathing behaviors such as panting, diaphragmatic breathing through a nose or straw. You can do pursed lip breathing or exhaling with a hissing sound. A lot of these are all just kind of distraction techniques that can help train the patient's breathing in order to help with the vocal cord dysfunction that they're experiencing. Another thing that you can experience or consider is heliox treatment, which is a treatment with a combination of helium and oxygen. It's very rare, but it is a possibility. Long-term treatments are avoiding the known triggers, whether it's smoke, airborne irritants, or medications. Treat the underlying conditions, such as whether it's psychological, whether it's anxiety or depression, or whether it's GERD or rhinosinusitis. It's mainly just finding out the underlying causes and then trying to treat that condition first. Another thing to do is to consider a trial of Atrovent in patients with exercise-induced symptoms. A lot of the times it's not always very beneficial, but it is something that you can consider. Another thing to do, though, to consider is referral for speech therapy. This is indicated in patients with unresolved symptoms. So if their breathing techniques are not working at home or the distraction techniques are not working, then you can go ahead and consider speech therapy, or if the patient is very concerned or if it's a major issue for them or if it's been a chronic problem, speech therapy is a good thing to do because they can help with the breathing techniques and helping them learn new patterns to avoid the vocal cord dysfunction. Another thing that can be used as a treatment is long-term tracheostomy, but that's only in very, very severe cases. So for my scenario, I have a 19-year-old female who is a college athlete that is complaining of continued asthma exacerbations and is following up after recently being diagnosed with exercise-induced asthma by her team physician 6 months ago. The patient presents to me in the office, and she is in her sophomore year in college. She manages to play for the basketball and the soccer team at the university she is currently attending. The patient complains of dyspnea during and right after activity, especially during her basketball season, she says, persistent cough that will not go away after a recent cold that she had 3 weeks ago. The patient states that when she has her asthma attacks, she feels like her throat is very tight and that she is choking. The patient states that the medications that the team physician prescribed are not helping. The patient also states that her basketball team has just made it to the playoffs and that she is very stressed out over the fact that she feels like her symptoms are not getting better and that she is afraid she will not be able to play, and this is causing some anxiety. The patient states that she has more serious exacerbations during basketball compared to her soccer season. So on the physical examination, The patient appears to be a normal, healthy 19-year-old with no current signs of respiratory distress. She is 5'6". She weighs 61 kilograms. Her vital signs are all within normal limits. Blood pressure, as you can see, is 109/70. Heart rate is 61. O2 stats 98. She's on room air. And temperature is 98.7. Nothing unusual there. The nares are all clear. There's no discharge noted, no irritation of the mucosa. Upon the auscultation of the lungs are clear on both sides bilaterally, and there's a normal inspiratory to expiratory ratio. Chest rise is equal bilaterally, and it's normal in diameter. There's no clubbing or signs of cyanosis noted in the fingers or the hands. Currently, the patient is taking medications that were prescribed by her team physician for the exercise-induced asthma. She is currently taking an albuterol metered dose inhaler that is to be used prior to the exercise, and she was also given Singular and Ceravent as needed, although she states that she tried them for a few weeks and they didn't help, so she doesn't use them and they just sit at home. Patient has no history of asthma as a child and also no family history of asthma. So due to the patient complaints and the way she is presenting, I would suspect that she doesn't have exercise-induced asthma due to the fact that she complains of tightness in the throat, meaning it's something more upper airway, and also the fact that she has a lot of stress in her life leads me to believe that it's causing the vocal cord dysfunction, that maybe she was misdiagnosed, and it'd be better to do some further testing to rule out vocal cord dysfunction and to figure out whether it's asthma or the vocal cord dysfunction. So in order to do more further testing, I wanted to order pulmonary function tests with flow volume loop, and this should be performed before and after 15 minutes of high intensity aerobic activity and also after inhalation of albuterol. The patient's also been given a referral for otolaryngologist for a definitive diagnosis. So after the diagnostic testing, the pulmonary function test results indicate vocal cord dysfunction. As you can see on this picture up above, it shows a blockage mainly of the air flowing into the lungs. Based on that, in the patient's history, vocal cord dysfunction is suspected. On the left side picture, you see the normal inspiratory and the expiratory loop. On the right, however, you see a normal expiratory loop with the flattening of the inspiratory loop, which is consistent with vocal cord dysfunction, and it indicates some kind of an upper airway obstruction, which explains a lot of the patient's symptoms. Also, the patient did follow up with the specialist, and the laryngoscopy was performed, and he provoked the patient by having her do some high-intensity exercising, and after that, he went in and took a look with the fiber optic scope, and he was able to get a visualization of the vocal cords, and it revealed a closure of the vocal cords during the inspiratory phase of a respiration, confirming the vocal cord dysfunction. So since the patient was misdiagnosed and does not have exercise-induced asthma and does in fact have vocal cord dysfunction, I would like to discontinue all previous asthma medications. I would like to educate the patient on vocal cord dysfunction, so that way she has an understanding of what it is and knows that it's not asthma. I would like to inform the patient on everything and really emphasize the fact that the vocal cord dysfunction can be exacerbated by increased stress due to the fact that she plays 2 different sports in college, and she's also going through college. There's going to be a lot of emotional distress and high stress situations, so I'd like to teach her about how that can contribute to the vocal cord dysfunction. I would also like to teach the patient breathing techniques that can be helpful when experiencing exacerbations. And since the patient is so stressed and she has expressed feelings of anxiety due to the fact that this hasn't been getting better, I would also like to suggest several speech therapy sessions to learn the actual corrective breathing techniques with the specialist. That way she can really go over it and feel like as though she's very prepared. And here are my references for the work that I use and all the information that I gathered. And that is it. Thank you very much. I hope you enjoyed.